So we will deal with two classes of, or two major groups of complications. On one side, everything that can go wrong if you inject in the vessel. And then the other thing is everything that can go wrong with HA fillers, mostly when you inject outside of the filler. So these are the two main things. That is what people are seeing in the field. That is people what might have as a complication when they are doing these. But I give them a very positive overview of what is possible, but mainly how they can avoid this, and if it happens, what they can do. So there's always a possibility to treat if you use HA fillers. So the first thing, if we talk about intravascular complications, intravascular blocking due to injection of a filler, of course the first thing is prevention. Know your anatomy. That is of paramount importance. Know the anatomy. Then if you know that, of course, even the best injectors can have problems because there are individual variabilities and variations in the position of vessels, for instance. That is so. We know that, but we have an aspiration test. We have other possibilities that, if you go to the bone, there's less possibilities to have or less chances to have an intravascular injection. So anatomical basis, that's the first thing. So, and then that's the main point for the intravascular thing. If we look at the everything that can go wrong around the vessel, if you inject outside of the vessel and there is a complication, the majority of the problems is arising from not enough sterile conditions, not enough cleansing. So, and we know, and that is the newest thing that I'm going to develop during my talk, that is the transition from infection via toll-like receptors on eosinophils towards hypersensitivity. And that is accounting for the majority of the late occurring phenomena, like lumping, like persistent erythema, like cystic reactions in a delayed way. If there is blocking. So if you had the chance and it happens, you see, immediately you will see blanching, and most of the time the patient will have quite a serious discomfort, basically pain. If that is the case, and you use hyaluronic acid, there's always a way to do something. We have an eraser, we have hyaluronidase. So the basic thing to do there is flood the area with massive doses of hyaluronidase, the whole area. Also, another possibility, if you can find the vessel where you have been injecting the filler, try to find the vessel, put in massive dose of hyaluronidase, and you might see that even on the spot, everything is clearing up. You asked me what I like specifically about Vicross. Well, this is I would say, the next level of filler technology. The specific manufacturing process gives us the possibility really to have tailored products that we can use in terms of if we need longevity, if we need lifting capacity, if we need natural result, if we need versatility. We have different products that cover that whole area of indications, and also of the requests and the desires of patients, and also what we want to achieve here. And now I must say that my workhorse in Vicross is really Voluma. That is what we do. So like a reframing in 10 points. Then I would say that is my reframing, my recontouring, my remodeling product. Then if I need really to have something with versatility, I use Volift, which we can use in nasolabial folds, which we can use in lips, which we can use in areas where we want a more superficial but versatile product versus Voluma. And then Volbella is really what I call the buzzword that I would use for that is finesse. We do that in little tiny lines. If we have resting lines in glabella, resting lines in crow's feet. If we need to fill the lateral palpebromalar groove and we need to address that, we do that, and teardrop with Volbella. Small quantities giving us really a tailored and a very precise finesse in our work.